Welcome to the ETAT training course. We've been running ETAT in KwaZulu-Natal for a number of years now. However, we've had a number of challenges in implementing ETAT in KwaZulu-Natal. And some of these are the inability of facilities to be able to release staff to attend the 3-day training course, the lack of opportunity for staff to implement ETAT once they get back to their facilities. And most important of all, we haven't really seen a reduction in the impact of ETAT, which is to reduce the number of deaths which take place in children in the first 24 hours of hospital admission. So we've relooked at the formats that we are providing ETAT, and we've decided to go for a blended format. So blended format means that there is some online course material as well as some face-to-face time. And we hope that you will enjoy this new format of ETAT. So, welcome to ETAT. ETAT is a WHO initiative to improve the quality of care for children in hospital and community healthcare clinics. In South Africa, 1/3 of deaths in hospitalized children occur within 24 hours of admission. And despite us knowing this for many years, the stat has not changed. To bring about change, we require improved staff knowledge and skills, essential equipment and resources, appropriate systems, and effective and efficient practices. We've divided our implementation of ETAT into 3 stages: pre-course material, face-to-face training, and implementation at hospital level. You have been provided with a training manual, 7 PowerPoint presentations, each of which will take about 20 to 30 minutes, and links to 5 sets of questions. Before attending the face-to-face training, you will need to have read through the manual and gone through the presentations. After each presentation, you will be directed to questions on the material that you have just been through. These are in the form of Google Forms, and you will be able to answer online. For those of you without internet access, a Word document will also be available. However, the preferred format is the Google form, as this will be marked immediately on submission. Your district facilitators will choose one of the following methods for the pre-course material. They will either direct you to do it on your own, where you go through the modules yourself and answer the questions yourself, or they will assist with facilitated study, which is where the narrated presentations are shown to a group of you. You may have a discussion around these presentations, but that you still need to answer your own questions. So each person that is doing the course needs to answer their own set of questions. To be invited to the next stage of the training, you need to obtain at least 80% for each of the tests. Now, you may repeat the tests as many times as necessary to obtain this 80%. And the purpose of this is that we want you to strengthen your knowledge before attending the face-to-face so that you can gain the maximum benefit out of the training. So use the manual and presentations to strengthen your knowledge in order to obtain the 80%. Once you have achieved this, you will be invited to the face-to-face course. The main focus of the course is skills acquisition, and it will be a 1.5 or 1.5 day course, which will be held at regional level with district facilitators from a number of districts. After the face-to-face component, the district facilitators will arrange to come to your facility. At the facility, they will go through an exercise of practical application of triage skills by going to POPD or the ward to practice your triage. They will review the site where ETAT is carried out to ensure that the flow of patients is appropriate in terms of the ETAT model. They will identify, together with you, a QIP project to implement ETAT, and they will provide feedback to the management. There will be ongoing interaction between the district facilitators and you as you continue to implement ETAT in your facility. So let's head to Module 1, which is Triage, to start your ETAT journey.